Good evening, community residents and panelists. Thank you for joining us tonight for the webinar, How to Stay Healthy During the COVID-19 Pandemic and Flu Season. My name is Lidia Manzanares, and I am a Pomona resident, a community volunteer, and I am also the co-chair of the Healthy Eating, Active Living Working Group of Pomona's Promise. This webinar was organized by the Pomona COVID-19 Action Committee's Health and Wellness Subcommittee. And I would like to thank our partners, Tri-City Mental Health, for hosting this event, and Pomona Valley Hospital Medical Center and East Valley Community Health Center for providing our panel of experts. These panelists are not only experts in their fields, they also work closely with our communities in the city and the region. We will have 3 panelists today. They will present, and that will be followed by a Q&A session. Please utilize the Q&A feature to ask your questions. The webinar tonight comes at a perfect time since we are seeing COVID-19 numbers steadily rise in LA and neighboring counties. Earlier this week, Dr. Ferrer with LA County Department of Health talked about the increasing numbers not being an anomaly, but rather that there is indeed a steady rise of infections. And earlier this week, LA County also issued a text alert to LA County residents, reminding everyone that COVID-19 is still here and that we must be vigilant and practice all the recommendations from health experts, like wearing masks and practicing social distance. This webinar will go over COVID-19 and the flu, some of the similarities and the differences, and how we can protect ourselves against both. And we'll also discuss natural ways to boost our immune system and prepare our body to naturally be our infection fighter. So with that, I would like to introduce our panelists. Dr. Daniel Gluckstein, Medical Director of Infectious Disease from Pomona Valley Hospital Medical Center. Dr. Aurelio Enriquez Jr., Director of Behavioral Health for East Valley Community Health Center, and Joselyn Caceres, Registered Dietitian and Nutritionist for East Valley Community Health Center. And now with that, I will turn it over to Dr. Gluckstein.
Okay, good evening, everybody. I hope you can hear me fine. I'm glad to be able to speak to you tonight as the Medical Director of Infectious Disease at Pomona Valley Hospital, and wanted to talk to you about particularly COVID-19, the flu, and what's coming up in the near future and into 2021 for all of us. First off, want to go over a few items. Just what is a virus for those of you that didn't understand this completely. There are small microscopic assemblies of proteins, genetic material, and sometimes sugar and fat molecules. They're able to invade cells and then use the cell's biomachinery to create copies. And there are thousands of known viruses, and they can infect all sorts of organisms, from plants, bacteria, fungi, parasites, and then animals and humans like ourselves. Over on the right is a little model of a flu virus with various proteins on the surface, an envelope that has fatty molecules and genetic material inside. And the cartoon down on the right shows how this can then invade a cell, create copies that come off of the cell, and then go on to infect other cells. So this is the general scheme that all viruses use to reproduce themselves and potentially create diseases. Just to give you an idea of the sizes of these, in this picture you can see a human hair over to the right that's well under 1/10 of a millimeter or so, and then over here to the left you can see is actually the coronavirus. Whoop, I'm sorry. So these are very small and we can't see them, but they can certainly create havoc with our health when they infect us. Now, unfortunately, while we're dealing with a difficult pandemic right now in our community and throughout the United States and the world, humans are not new to pandemics, and they have been part of human cultures for quite a while. Going back to ancient history, the most prominent pandemic of the last 100+ years was the Spanish flu in 1918 and 1919, and now we're dealing with COVID. The Spanish flu was a very severe disease, so we certainly expect to see more pandemics in the future, and we've had smaller ones even in the last few years, including Ebola and Middle East respiratory syndrome, swine flu in 2009, and so on. So these are ongoing problems that we'll have to deal with, particularly as we can travel more around the world, and there are more people interacting with the environment where a lot of these viruses and other organisms live. A little bit about the flu pandemic of 1918-19, because it has a lot of parallels with our experience now. This was certainly the worst pandemic in a long time. And again, over 100 years ago now, but about a quarter to a third of the world's population became sick with this. Worldwide, there were 50 to 100 million deaths, and this disease was somewhat unique in predominantly causing deaths in healthy young people ages 20 to 45. So a unique feature. In the US alone, when our population was about 100 million people overall, over 500,000 people died in the United States, or about 1 in every 500 people. And even in just the month of October, almost 200,000 people died. So this was clearly more severe than what we've experienced with COVID since the first cases started here in the US in February, as far as a single month. But these are some of the parallels that they saw then, and emphasized in the writings about this, that it was quite unpredictable. They saw rapid surges in cases in several waves, and frequently each wave became more severe. Again, this unique feature of young people tending to get even more sick and die than other typical groups. But they found that a lot of the things we're still dependent on now, just mask use, restrictions on public gatherings, and protective sequestration, basically social distancing and staying at home, were very effective in decreasing flu cases. They certainly saw field hospitals that need to be set up due to overcrowding in existing hospitals. And as well, with social distancing, this town of Gunnison, Colorado had no cases in a town of 1,300 people over 4 months' time. So these things work then, and they can still work for us with COVID, though they're difficult to do. This is the typical course of standard influenza that we usually see every winter. It has an incubation period from when we're exposed until people get sick of 1 to 2 days, and then usually a fairly abrupt onset in the blue line of typical flu syndrome of fever, muscle aches, headache, fatigue, sore throat, and dry cough. Usually this lasts about 4 to 8 days and then gradually resolves within a few weeks, and the person can be contagious for about a week. It can have serious complications of pneumonia, strokes, worsening of heart and lung disease, and as well rarely death, but most of the time it's a relatively mild illness with seasonal influenza. How this is spread, just like we've heard with COVID, it's mainly by these droplets that are about 10 microns in size that we produce when we talk, more of them when we cough or sneeze or shout or sing. These tend to occur in winter outbreaks that peak in 2 to 3 weeks and last a few months. The flu, like a lot of viral respiratory diseases, usually starts in school children and then spreads to adults. And when it's in the schools, you'll see increased absenteeism, and then this spreads to adults in the workplace. And then over the succeeding weeks, increases in hospitalizations for pneumonia and deaths, mainly in very young children and the elderly with flu. Just to get an idea, every year the CDC and lots of health departments track flu cases and their effect on our society. And in the US, we generally will have about 25 to 50 million symptomatic flu cases, as well as about an equal number of asymptomatic. Lots of days of illness and lots of lost school and work days, on the order of under 100,000 to over 500,000 hospitalizations, with 20,000 to 60,000 deaths every year. And it certainly costs our society as well billions of dollars. Now, we do fortunately have both medications to treat influenza, and we have influenza vaccines that are modified every year. These aren't fully effective, but they do still offer value in that they will reduce illness in yourself and reduce the risk that you can spread it to your family members and contacts. They clearly also are more effective at reducing hospitalizations and deaths than just preventing disease itself. As well, we now know that with every peak in flu every winter, we tend to see increases in complications that are not purely infectious, including heart attacks and strokes. We know as well influenza in pregnant women can be a serious disease. And so getting vaccinated can help prevent women from having complications during pregnancy. And as well, particularly if they're breastfeeding after they've been vaccinated, they can protect their infants after they're born as well. So flu vaccination is still an important part of preserving your health and that of your family and community. Switch a bit and now talk about the COVID-19 pandemic. This is clearly a new disease in humans that started in November or December of 2019. So that's why it's called COVID 2019, shortened to 19. It's a disease that was clearly in animals before, but somehow jumped from bats and maybe an intermediate other species to humans in Wuhan, China, late in 2019. The virus itself is now called SARS-CoV-2. It's very closely related to a similar coronavirus that infects this Chinese horseshoe bat. And these viruses had already been identified from the bats in 2015 and 2017. Just to give a feeling about the COVID-19 and the family of coronaviruses, there are lots of coronaviruses that infect different species of mammals. You can see a bunch of rodents as well as bats. Over on the left are 4 strains of coronaviruses that actually have been circulating among humans as sort of a common cold syndrome, mainly runny nose, sore throat, cough, but not severe disease for a number of years. We then had problems back in 2002 to 2004 with the SARS-CoV that transferred to humans from the civet cat. As well, we've had intermittent cases of the Middle East respiratory syndrome coronavirus, usually transmitted from camels to humans. But clearly the SARS-CoV-2 COVID-19 pandemic has been the most dramatic of these more severe coronaviruses. This is the structure of the SARS-CoV-2 virus that causes COVID-19. Again, like all viruses, it tends to have these outer proteins, and the spike glycoprotein in yellow is an important part of how the virus interacts with the immune system and attached to cell. It then has this envelope that's made of fatty molecules that then encloses in the sphere the genetic material of the virus, as well as some other proteins to help it reproduce and attach to cells. So the symptoms of coronavirus, I think most of you are quite familiar with these. These usually are not too different from the flu or lots of other viral respiratory infections. Initially, usually cough, some shortness of breath, but not too severe, with fever and chills, some muscle aches. This virus tends to not infrequently cause some vomiting or diarrhea, and a somewhat unique symptom that occurs in about 15 to 20% of people is a fairly dramatic loss of a taste or smell. These symptoms tend to occur both in mild and severe disease and can occur with an incubation period of 2 to 14 days after you're exposed, but most of the time you will develop symptoms if you're going to about 4 to 6 days after exposure. Now, the good thing is most people with coronavirus infection do not develop severe disease and can stay at home and then gradually recover after a week to 10 days. However, a subset of people, about 15 to 20%, progress to severe disease with more dramatic trouble breathing and shortness of breath, chest pain, oftentimes confusion or even coma. And then because of low oxygen levels, their skin becoming bluish with severe shortness of breath. Down on the bottom of this picture, you can see relatively normal lungs on a CAT scan as the dark black, dark gray areas. And then over on the right, somebody with severe COVID pneumonia on the CAT scan shows extensive damage to the lungs with these white areas causing inability to breathe well and leading to hospitalization. This is a chart that sort of shows the stages of coronavirus. We've learned a lot about this disease since it began in China in January. So there are various stages. Early on, after you're exposed to the virus, you may have no symptoms and never develop symptoms, or you then go on to develop symptoms. This usually can last again up to 2 to 4 days or even the entire illness. If you did have a test for coronavirus, you would find that you were infected. You are infectious to other people, and so should isolate away from other people. At this stage of disease in the blue, you can see virus is reproducing itself, and this continues on for about a week to a week and a half. We do have some treatments that might work at this stage with antiviral medications or antibodies. Usually in the mild disease or asymptomatic or pre-symptomatic, you can generally stay at home and be sure you're eating and drinking well and getting plenty of rest and avoiding infecting other people, and you'll do fine. However, some people generally at about 10 to 14 days into illness progress to moderate or severe disease. And at this stage, virus reproduction is decreasing, but there's an unusual feature with this disease of a more dramatic immune system driven inflammation of tissue, particularly in the lungs, that can cause problems with worsening shortness of breath. And so we will see more severe pneumonia, declining levels of oxygen, increasing breathing rate. And again, the tests for coronavirus will be positive. You are infectious usually into this stage, at least for 10 to 20 days. And oftentimes you would need hospitalization with oxygen, potentially viral medications, as well as antibody treatments, and also treatments that may reduce the inflammation in your lungs and the rest of the body, as well as medicines to prevent blood clots. And about 5% of people who come to the hospital end up with critical illness in the ICU and are at high risk for dying from this severe infection. So we've learned a lot about what the risk factors for severe COVID are. We know a lot of people can get COVID and do perfectly fine. And this infographic sort of shows how we can acquire COVID in the community, particularly in crowded situations where we have close physical contact in an enclosed space and for more than 15 minutes. By age, we can see that age is a major risk factor for COVID as we get older. And the chart below shows if you're 18 to 29, you're sort of the general group that does well with COVID, but even for younger people, they're even less likely to end up in the hospital and much less likely to die. But you can see as age increases from 30s to 40s and up to 85 plus years, the extremes of age at 85 and or above, you're 13 times more likely to be hospitalized than somebody who's 18 to 29 and 630 times more likely to die. So we now know, particularly as people get into their 40s and 50s and 60s, that their risk of severe COVID greatly increases. And this is why if you live with somebody who's older, you really want to protect them from this disease by being sure you don't get it and transmit it to them, as well as them being safe. So the precautions we can do, as we've all heard, are wearing masks, stay at least 6 feet away from people, cleaning our hands frequently, disinfecting high-touch surfaces. And you want to keep these things in mind about who's at risk. Now we know also, comparing COVID to flu, you may have heard that COVID is just sort of like the flu, but it's clear that it has a much higher risk of hospitalization and death. So people with COVID are 17 more times likely to end up in the hospital. And if they end up in the hospital, compared to somebody with flu in the hospital, 5 times more likely to die. We also know that certain groups in the population are much more likely to develop disease and develop complications. African American or Hispanic persons seem to be at higher risk than white patients. And so preventing flu and COVID can really help us to stay out of the hospital and avoid any risk of severe disease or death from this virus. Just a little bit about what's going on currently with the virus and where we've been. This chart shows in sort of, let's see if I can pull up the pointer here. There we go. This is the United States. So initially we had a spike in cases in March through April. It didn't decline very much. And then beginning about the middle of June, a much more dramatic increase up to, and this is adjusted per population. So larger countries versus smaller countries, the rate per population is still comparable. So we had this peak in midsummer, right about at the end of July, declined a bit, but we never got below even our shoulder that we had in May. And now we've had a dramatic increase in cases in the United States. You can see here again. You know, compare that to the curve for France here, which had a peak early on in the spring, got down to very few cases, but then beginning in the summer, dramatic increase. This was also seen in the United Kingdom, less so in Germany, less so in Canada, and then a host of countries that have done amazingly well at controlling this, including Japan, South Korea, Australia, and Vietnam. So you can see, if you can get the numbers down very low, you still require precautions to keep them from jumping up, as we're seeing in a lot of European countries, as well as the United States, though we never got our numbers as low as they did in Europe in the late spring, early summer. Geographically, you can see now, and this is by counties, there are huge numbers of counties throughout most of the center of the country that are red with very high levels of COVID. Some of these, particularly in the upper Midwest, have rates of COVID that are 10 to 20 times what we've experienced in Southern California. And this again is the graph for the US as a whole. So dramatic increases already, and certainly we're very concerned if these trends continue into the winter months, and particularly with holidays of Thanksgiving and December and New Year's holidays and people gathering, we may see huge increases in COVID in the next 1 to 2 months. This is California data on the left, and again, we had an increase in the early spring, then a much more dramatic, fairly broad peak in the middle of the summer. It came down, but never got to very low levels, and now we're going up again. So we want to try and blunt this and drive it down in the near future, rather than having it rise higher than our experience in the summer when our hospital was full with lots of patients. On the right, you can see a very similar pattern for LA County through yesterday. So we still want to try and interrupt this increasing transmission of COVID in our communities. So how do we prevent COVID? These are really the same things that were our major tools to control pandemic influenza back over 100 years ago. And these are sort of Anthony Fauci's favorites. We need to wear masks consistently, maintain physical distances, avoid crowds. If you're going to be around other people, you ideally want to do it outdoors if it's not just your immediate family. Frequent hand hygiene, cleaning high-touch surfaces. If you're sick, you really need to stay away from other people, and getting a flu vaccine is also important to prevent the spread of COVID and other viral respiratory diseases. A little bit more about masks. Early on, we didn't know these worked to prevent COVID transmission, but now we have very good evidence that they are very effective means to prevent transmission. And a lot of the countries that have controlled COVID since early outbreaks in the spring have done it through extensive mask use among the public. You want to have a mask that has at least 2 layers of a breathable fabric, not just 1 layer. You want to be sure it completely covers your nose and mouth and isn't so loose that air can leak out a lot on the sides. So it should be fairly snug to your face. You don't want anything that's hard to breathe through as well. Some of the masks that are often sold at hardware stores for use when you're painting or with dust exposure are good for preventing you from breathing in, but unfortunately they have valves that do not stop you from shedding COVID to your neighbors. And then we have special masks we use in the hospital called N95 masks that are a little more difficult to use and need to be properly fitted. So for most of us in our general lives, using a cloth mask, or you could also use some of the surgical masks that also work fairly well. We also now know that the gaiters that some people have, if you make it into 2 layers, it also works fairly well. We don't yet know about face shields since there can still be a lot of air leak and possible droplets around the sides of these. A few words about children. There are masks that children can wear. Generally, we don't recommend them for children under the age of 2. They just usually will have trouble keeping them on and may handle them a lot and potentially contaminate their hands. But you want to, again, be sure it fits well so that it's comfortable for the child, but prevents them from being exposed to COVID or shedding it themselves to other people. So here's some of the mask do's and don'ts. You want to not pull it below your nose. You obviously see this all the time in people in public. You want to also cover your chin to prevent leakage at the bottom and not just wear it around your neck. You don't want to touch it and potentially contaminate your hands when you're taking it on and taking it off. You want to just use the ear straps. You want it to be snug enough so that it has somewhat of a seal around your upper face and sides of your face and below your chin, and you don't want it to get soiled or dirty while you're wearing it. So when should you wear a mask? Again, if you're interacting with people outside of your immediate household, you should be wearing a mask. When you're in public, if you're sick and interacting with people at home or interacting with somebody at home who is sick, both of you should be wearing masks. And obviously, if somebody in your household has COVID or another viral respiratory infection, this can help keep you or them from becoming sick. Again, we talked about generally not using masks on children under the age of 2. And we clearly know now that having both parties wear a mask when you're interacting with somebody is much more effective than just one party. Your mask really protects them from you more than it protects you from them. So having both of you wear a mask is key. So while we're using these old school prevention measures, we clearly are now seeing progress in COVID-19 vaccine development. There's been a lot of work in this area, and this is really a dramatic scientific advance in a very short period of time. There are now currently 52 vaccines that are being studied in humans for use against COVID. And just a couple of days ago, this Pfizer-BioNTech vaccine had a press release that showed really dramatic efficacy in preventing COVID symptomatic disease compared to a placebo injection of just salt water. This is a new vaccine technology using the genetic material to create this spike protein that then tells these antibodies in green that bind to the virus and prevent you from getting sick. So far, there's been no safety. The study has to go at least another 2 weeks to continue to assess safety. Currently, this vaccine would be given as 2 doses 3 weeks apart. It unfortunately does have a requirement for storage at extreme cold temperatures, not anything that can usually be attained in a standard refrigerator or freezer, so that will be a bit of a difficulty. If we continue to see good data on safety and efficacy, it's possible the Food and Drug Administration of the United States may give an emergency authorization for this by the end of this month. And the studies to look at safety and efficacy will need to go on for at least another 1.5 or 2 years, so we can learn more about, does it have long-term efficacy in preventing COVID. But we've really made huge progress, and there will likely be other vaccines that will also have some data on efficacy and safety coming forward in the next few months. Vaccine distribution is going to be somewhat difficult. It's clear we want to give this vaccine to the highest risk groups, either by age or underlying disease or socioeconomic risk of acquiring COVID. And so there will be systems that are coordinated between both the states and federal governments as well as local health departments moving forward with this. So we've had interactions both with hospitals and other healthcare settings with the California Department of Health and Health and Human Services and the CDC to sort out how this is going to work. But it's quite possible we will start to see some vaccine distribution by sometime toward the end of December and certainly into January and February, and then probably more so for lower risk groups in the general population into spring or summer. Just again to summarize, how can you tell if you have influenza or COVID or just a cold? The trouble is a lot of the symptoms are very much the same, except COVID has this more unique feature of fairly profound loss of taste or smell in some people. Influenza has a shorter incubation period in general. They're contagious for about a week, a little longer with COVID. Transmission is usually by these fine droplets when we talk or even just breathe, and certainly more so when we shout or sing. COVID tends to be a bit more contagious, and we tend to see more super spreader events, particularly in crowded spaces with nobody wearing a mask and poor ventilation. Flu tends to affect young children as well as the elderly most prominently, and those of us with chronic illnesses or pregnancy, whereas COVID tends to spare young children. It can infect them, but they usually don't get very sick except rarely. But COVID clearly is a very potent agent to cause severe disease as we get older, and as well in people with chronic illness or pregnancy. We test with similar kinds of tests that are specific for each virus. We do have several drugs that are fairly effective for influenza. We're still in the early stages of drugs for COVID-19, but making some progress. And clearly we have flu vaccines, and it looks like we may very soon have the start of distribution of some COVID vaccines. So things are looking up even just compared to a few days ago, but we've got a long ways to go with this disease. So just to summarize a little bit about who should get an influenza vaccine, Anybody over 6 months of age should get one, number one, and particularly high-risk groups, children over 6 months but under 5 years, adults 65 years of age or older, pregnant women, anybody over the age of 6 months with chronic medical conditions, including asthma, diabetes, heart disease, kidney disease, lung disease, prior strokes, almost anything that you're seeing medical treatment regularly. If you're living with people with high-risk conditions, then you getting a flu vaccine helps prevent you from transmitting the flu to them. Some things about the vaccine: since there's no intact virus in the vaccine, it cannot give you the flu through the injection. It's very safe and again prevents serious complications or death from influenza. Every year it's updated with circulating flu strains to match what's likely to be infectious that year. It cannot give you COVID-19, just like it cannot give you the flu as well. Antibacterial drugs do not treat influenza. You would need specific influenza drugs to treat this. And why should you get the flu vaccine during COVID? One of the problems, if you get a fever and cough, you now really need to be tested for both viruses because you may have either one or just a regular cold or other viral respiratory infection. You're going to need to self-isolate yourself from close contacts until you get results of testing. Your family members also will need to stay away from you pending your test results. Certainly if you got sick enough to need hospitalization and the hospital system is already overburdened with COVID, additional flu cases can certainly stretch the capacity. And lots of years when we have lots of influenza in the community, we see very crowded waiting rooms and very crowded hospitals. So this is a major concern. As well, you would need to notify contacts that they may have been exposed to COVID. So for all these reasons, it's important to get your flu vaccine as well to eliminate a lot of these difficulties and confusion in the coming months. And so again, we've sort of talked about risk groups, both for flu and COVID, heart disease, immunosuppression, obesity, asthma, diabetes, chronic lung disease. And then a lot of people, even during flu years before COVID, would end up in the hospital from complications of influenza. And again, we know we can prevent flu with vaccination and as well prevent flu and COVID with social distancing and mask use and the other safe precautions. So this becomes really important as we move into the winter holidays and risk for both of these diseases. Where can you get a flu vaccine? Pomona Valley Hospital, in concert with LA County Public Health, will be doing another drive-through flu clinic on Saturday, November 14th. So coming up in the northwest parking lot, and these are directions here to enter on Willow Street. And this is drive-through only. You don't need an appointment. And we'll be able to vaccinate those 6 months of age or older. And we will actually have cloth masks available as well. So if this is the best way for you to get your flu shot, we certainly want you to come and get it this Saturday. As well, if you prefer to get it through your physician's office, a neighborhood pharmacy, outpatient clinics through Pomona Valley Hospital. There are also public health clinics and some of the LA County libraries. You can use this website, www.findaflushot.org, to look for one near you as well, because the best time to get your flu shot is really right now as we approach Thanksgiving and then the December and January holidays, because it takes about 2 weeks to develop immunity from your vaccine. And so you want to have time before potential exposure to flu. So in summary, we really want all of you to make your holidays COVID-19 and flu safe. Really basic things. Again, these are really 19th century protection. Stay at least 6 feet away from other people. Cover your face and nose if you cough or sneeze. Wear a mask in public and be sure other people around you are. Don't touch your eyes and mouth. Clean and disinfect frequently touched surfaces. If you're sick, stay home and away from other people. And continue to disinfect or wash your hands with soap and water or alcohol hand gel. And we'll all be safer as we go into the holidays in the coming weeks and months. And stay healthy until you can get your COVID vaccine as we approach the spring and summer months. So glad to take any questions at this point or save them for the end if there aren't any right now.
Thank you for that presentation, Dr. Gluckstein. I think in the interest of time, we will keep all the Q&A at the end of the session, but thank you very much for that very informative presentation. Now I will hand it over to Joselyn Caceres. She is with East Valley Community Health Center.
We can't hear you, Joselyn. We can't hear you still. Are you on your phone?
Can you hear me now?
Yes. Yes, we can.
Is that better?
Yes.
Okay, great. Sorry for the technical difficulties. We were having a little bit of like a staticky issue before. So that's why I was trying to use my phone. But anyway, thank you for your time. So the big question is, how can we improve our immune system, right? Overall, your immune system does a remarkable job of defending you against microorganisms that cause disease. But sometimes it fails. A germ invades your body with success and it makes you sick. So basically, our goal with this presentation is to talk about some factors that may impact our immune system and its ability. Let me share my screen. All right, let's see here. I think I can move it this. Okay, perfect. So in this slide, we can see several factors that can compromise our immune function, right? One of those being cigarette smoke and pollution, chronic stress, whether it's physical or psychological, sleep deprivation, excess alcohol consumption, poor diet that leads to suboptimal nutrition status, and that my main focus today will be on this specific factor. Okay. A direct relationship among nutrition, infection, and immunity exists. Changes in one component affect others. Poor nutrition can compromise immune function and increase infection risk. Various micronutrients are essential for immunocompetence, which is the ability of the body to produce a normal immune response after exposure to an antigen. And particularly certain vitamins such as vitamin A, vitamin C, vitamin D, vitamin E, B12, B6, B2, folic acid, iron, selenium, and zinc. These micronutrient deficiencies are recognized as a global public health issue, and poor nutritional status predisposes us to certain infections. Immune function may be improved by restoring deficient micronutrients to recommended levels, thereby increasing resistance to infection and supporting faster recovery when infected. So what can we do to improve our diet? Aim for an eating plan that's largely based on a variety of fruits and vegetables, whole grains, legumes, nuts, and seeds, because plant foods have so many benefits. And not only do they have vitamins and minerals, but they have fiber, phytonutrients, lignins that are extremely important for body function and for proper maintenance of the immune system. Include different colors of fruits and vegetables to get the vitamins and minerals and antioxidants that support your immunity. And like I mentioned, those specific vitamins. So the thing about food, I know sometimes we want a magic pill, but the food content, the actual food content is what matters. And the different color of the fruit or the different color of the vegetable, the different property it will have. And that's why we always say have a rainbow in your plate. The more variety you have, the more nutrition you will get, because each color represents a different vitamin or mineral or other nutrient that I just mentioned. So I know that sounds extremely broad, and that's why we try to work with patients to aim for a very specific goal. That way we can stick to it and we can put it into a daily habit and hopefully bring healthier habits into permanently our lives. So I set a little example here. I hope you can see it, of setting a goal. So after each slide, hopefully together you and I can set a goal for yourself. In this case, for example, if you ask, oh, what would be a good goal to help nourish my body a little better, that I wrote here, I will eat 1 fruit per day from Monday through Friday as a bedtime snack, right? So let's say any fruit will do. So Monday you'll have blueberries, Tuesday you'll have an apple, Thursday pineapple, Wednesday an orange, and then Friday melon. So you met your goal because it was very specific. You know you're supposed to have a fruit right before bedtime, and you know you got a different color every day. So you got a different nutrient every day, therefore enhancing nutrition. And then in the bottom of the slide, I just put a little bit of examples. So like carrots, papaya, mango, broccoli, tomatoes, those have vitamin A. Sorry, I forgot to put the A there. And then the other fruits contain the other types of vitamins. So that's why a variety is super, super important. Sleep. Getting at least 7 to 9 hours of sleep at night will keep your immune system strong. So studies show that those of us who don't get quality sleep are more likely to get sick after being exposed to a virus. The specific study actually showed that those people getting enough sleep we're 3 to 5 times more likely to beat the virus in this particular study. So does it matter if you sleep well or not? Yes, definitely does. And of course, depending on the age, this is the 7 to 9 hours of sleep is for a population of, I believe it was 18 years old to 64. Teenagers are 8 to 10 hours, so it differs per group. But the main point is that sleep definitely matters for immunity. And then a goal, then again, I set an example of a goal that would be, I will begin a new bedtime routine of shutting off the TV and instead read a book of 30 minutes before bed 3 nights per week. So again, this goal is specific, very detailed, and something that you can keep in mind at all times. So some tips for better sleep would be set a consistent wake time and bedtime. Okay. Use bed for sleep only, so don't have your office there. You know, now that a lot of people are working from home, don't have your laptop there because your body can then get confused. Wait, am I working? Am I sleeping? So anyway, just use it for sleep only. Stay hydrated during the day. Have a caffeine curfew. Americans, we love caffeine because we are always on the go and we need that spike to keep us going. So try to limit your caffeine intake till 2 p.m. so that it doesn't keep you still going too when you're trying to take a nap or go to sleep later on. And limit blue light exposure from screens. So phones, laptops, TV, at least 1 to 2 hours before bed. That's why I put that goal of reading the book instead of going over your phone or through your social media, or you can have no blue screen and putting, a book instead to just kind of relax you, take that away, and to sleep better. Physical activity. The World Health Organization recommends that adults exercise at least 150 minutes per week. And consistent exercise will help maintain a healthy heart and strong lungs, improve mood, hopefully. Weight management will prevent you from gaining excess weight. Of course, food matters a lot in this particular scenario too. Decrease risk of injuries, prevent and manage diabetes, high blood pressure, high cholesterol levels, heart disease. So it's like kill 5 birds with 1 stone, basically, and improve sleep as well. And so pick your movement, whether it's walking, jogging, dancing, jumping rope, weightlifting, cycling, any movement, honestly. Some people garden, pick a family friend, take your pet out, just anything that might encourage this behavior. And exercising during COVID-19, of course, we have to do this safely. Exercising outdoors and the pandemic is safe. Remember just to wear your face mask like Dr. Daniel explained, and maintain a safe distance between your surrounding or anyone who you're going with. Drink plenty of water. Staying hydrated helps their organs function and stay healthy. So water has multiple purposes, but I just put 3 because otherwise that would take a long time. It gets rid of waste through urination, perspiration, and bowel movements, keeps your body temperature at normal levels, and protects sensitive tissues. If you're not having enough water, you might feel some symptoms of dehydration, thirst, headaches, muscle cramping, fatigue. And even with water, we can also set a goal. I know I forgot to mention for the exercise a goal, but I hope you read that on the slide. But even putting like, okay, I have this, I have this flap, right? Okay, so my goal is to have 2 of these by 4 o'clock every day, 5 days a week. So at least, again, specific goal, very detailed goal, something that will stick to you, and you know that it's 2, and that's it, at least. And I think that wraps up my part. These are some references that I used for the presentation, and these are just some of our social media where you can follow up. Sometimes we put nutrition advice here, some tips of staying healthy or managing certain conditions. But yeah, I hope you could hear me okay. I'm not sure, but thank you for your time and for listening in. And I think you mentioned that we will be taking questions at the end. So I'll wait for those questions in case anyone has any.
Thank you, Joselyn, for that great presentation. And thank you for all the tips and encouraging us to set goals as we sort of plan out our days. So now I want to kick it over to Dr. Aurelio Enriquez Jr., who is also with East Valley Community Health Center, and he will take us home before we go to Q&A.
All right, good evening, everyone. Again, I'm Dr. Aurelio Enriquez, licensed psychologist and director of behavioral health at East Valley. Yeah, I don't have any slides to show, but I will go through sort of a structured method of sort of addressing your mental health and indicators that you might have to confront and deal with during the course of the flu season and of course COVID. COVID in itself has really created a lot of situations that have been quite difficult for families to deal with. And so some of the sort of more immediate and I think important elements to try to do as you're sort of dealing with this is sort of recognize and be able to identify, what exact changes have occurred in your life and the sort of general operations and functioning of your family. Because oftentimes, life responsibilities like work, meetings and, social connections and all that typically set our framework of how we live our lives. And now during COVID, it's a huge responsibility for us to be able to make our own sort of structure and how our life is going to be. So, setting a schedule, outlining what you sort of plan out, day in and day out, and try to sort of get back to as much of your previous lifestyle that you could, and of course, in a very safe and considerate fashion. So taking hold of your time and giving yourself breaks and opportunities to care for yourself, number one, and be able to care for your family. Before media, social media tends to be a big part of how we manage our lives today. Understand that under the strain of COVID and the restrictions in which we are tolerance level, or emotional tolerance level isn't the same as it's been before, because of course there's been sort of other elements in how we can let go of our stress and manage our stress, which is no longer available to us. It's really important also to try to maintain continued connections with people who you care about, your social network. Of course, now being the video conferencing elements, but still try to maintain that connection and feel like that's still an important element of your life. As we had just heard now with the nutritionist, and she spoke about the importance of exercise. We all know that gyms have been either highly restricted or even closed altogether, and trying to find methods in how you could find ways of exercising within the space that you exist in is crucial. Keeping your physical health, and we know that a nice brisk walk 4 to 5 times a week is almost equivalent to a low dose, medium dose of an antidepressant. So you will have emotional and psychological benefits from maintaining your exercise regimen, at least to that degree. It's important also to use the safe areas outdoors that are available to you. So if you have a yard, gardening, finishing activities at home, things like that are important in sort of keeping the body moving, and of course getting the benefits of the exercise. Now, it's also important to be able to recognize that these activities also are part of an exercise, because mentally, and it's been shown through research, that if we can connect certain activities, even though they're work related, but know that, hey, we're burning X amount of calories, or this is what we're doing, this is part of exercise, the body responds better to that as well. And so it sort of takes your mental state into account as far as how it reacts. Now, again, being aware and mindful is crucial. Oftentimes we've heard of some anecdotal information coming out where they're seeing a huge spike and increase in domestic violence and aggression within the home because of limited movement and access to outside resources. So being able to recognize and identify changes in yourself, changes in other people within your family, it can also be really important. And I think it could play a big part in how quickly you can address those issues and not have them sort of evolve into something much larger and much more significant. Again, with anxiety, with stress, for adults or even for, as young as teens, the often method of relieving that, it could be through the increased use of alcohol and recreation drugs. So this is something that one needs to be sort of aware of and be able to address it as quickly as possible. Again, I think also learning and becoming more proficient in communicating with people around you and being aware in how you sort of respond to people is again an important element of our mental health. I think that we live vicariously through very close family members, oftentimes. So when mom and dad are stressed out, the children can also become stressed out as well. So being able to sort of attend to those emotional needs for the purpose of, number one, taking care of yourself, but also knowing that it does drive the energy, and it does drive oftentimes the wellness of the whole entire family. And so, being able to do that and recognize that is crucial. Focus on fun. Now that, that there's some limitations, it does ask us to revert back to activities that being able to do that, or create games within the family and have fun together, interact together in a way that's, that brings, that happiness and brings that connection between yourself and other members of the family is important. So, and of course, just as important as anything else is whenever there are events or situations or circumstances that seem much larger than what you could manage, is asking for help. Asking for help earlier, the better. Again, not all interventions and not all services are based on any kind of specific mental illness, but there are services that are preventive in nature. There are services that are interventions that are early on prior to a pathology forming itself, that provide guidance and skills and abilities to help one sort of deal with the emotional aspects, and of course the changes that are occurring around us that could potentially be overwhelming. So yeah, there's a lot of sort of generalization in the information that I provided today, and there are more specific techniques in how that could be done. So I would suggest that being able to explore what those look like, and then integrate those into your day-to-day living, I think could help a lot with some of the secondary factors that come with dealing with some of the restrictions imposed by the flu season and COVID, such as boredom, such as our tendency to ruminate, sort of obsessively think about things that really don't have any kind of solution or purpose. Our ability to manage stress and to manage irritability and sometimes, oftentimes, anger and aggression. So there's a lot to that one could accomplish during this period of time that can be quite beneficial in through the course of our lives and the course of the lives of our children. So again, I'm always available to offer some education and sort of linkage information to resources that would be available to you or family members, and where they can acquire these type of services or get more guidance on how to apply some of these activities.
Hello, everybody. At this time, I do not see any questions. I guess, I can agree to this, that the presentations were really good. And you answered all the questions. And I wanted to say thank you on behalf of Tri-City. These were great, great presentations. And also for our attendees, we will certainly make this presentation available. It will be available on Tri-City's website for sure. And if you would like to have a copy of this presentation, please let us know. We can make that available to you.